Hi, my name is Phil. I'm one of the co-founders of GOrendezvous, and thank you for joining us today. We're very happy to have Michel Charbonneau as a guest presenter to come and present their eClaims product. So on this, I'm gonna give him I'll let him take over and present all of it. Thank you.
Right. Thank you, Philip. So yeah, I'm not going to present everything. Philip will still do the GOrendezvous demo. So from the get-go, just wanted to let you know that, yeah, we're going to have a live presentation and we'll go into the GOrendezvous and explain to you how it works directly from there. So you're going to get a first hands-on on how it works. Also, wanted to take a moment to thank GOrendezvous for this opportunity to present. The eClaim direct billing solution has been around for the last decade, but it has only recently come into the market for Quebec in particular, and also for those technician physiotherapists that weren't recognized prior to 2008 by most of the insured, which now that changed a lot, and we couldn't be more happy to have worked with the college and people like GOrendezvous to get this moving forward. And we'll talk about it in a few seconds. So without further ado, let's look at the and let's look at who will be presenting today. Well, okay, so we can skip to the agenda, but so Philip and myself, so I'm Michel Charbonneau. I'm the account executive director for the eClaim TELUS Health direct billing solution. I've been doing that for the last 17 years with the TELUS team. I am also a specialist from Harvard in leadership and management. So I do have the experience on how it works in your clinics. I've sit down and spend days with a lot of clinics across Canada to understand your day in and day out and how management is done with keeping the books for your business. Right. So let's go ahead with the agenda today. What we'll be covering. So for today, we're going to go through these. What is eClaim? For those who have no idea what is eClaim, direct billing solution from TELUS. Why even consider using eClaims? What's the reason that you should take in consideration for it? And who can register? What type of healthcare providers? So you might be a physiotherapist, but you might also be a physiotherapist that works in a multidisciplinary clinic. And we do recognize over 18 different types of healthcare provider for electronic claims. And we keep adding more and more. So we'll talk about that. Then Philip will go through on how the integration works with the GOrendezvous, what are the benefits, how it makes it so seamless, and you're going to see that it's way easier to use it through GOrendezvous than using our standalone portal, because you have to retype the information. With GOrendezvous, well, it's all done for you, so that's great. And then we'll conclude with how do you sign up to the eClaim service, and go through some question. And just before we start, I would like to mention that through this presentation, if ever you caught me stating terms for customer or patient or consumer, please do know that customer or patient or consumer is all the same person, and just choose the one that is applicable to you. So some people will say, oh, they're my clients. Some people will say they're my patient, and so forth. So, all right, so let's move to. All right, so we did a little survey recently, prior COVID, actually, I should say, and we survey in the COVID time, just state different thing because reality changed, but prior COVID, and we're going back to normal. So the interesting statistics that I wanted to share with you, which comes from that market study, but also to mention that this was done with 500 Canadian client patients to better understand their opinion on direct billing. So the first stat that I want to present is that 3 out of 4 Canadians believe that direct billing would improve their experience when they visit a healthcare provider. So 75% Canadian with private insurance definitely consider direct billing as an influence when they go and see you, and they come out of that appointment and they say the appointment was great, that the service was very professional, and on top of it was direct billing. How much better can that be? So that's really good. And you know, a happy customer is also a customer that will refer you. And we're in a day and age with social media. People will just go online and say, oh, I heart my physiotherapist, right? And all of a sudden, everybody's coming to you and you don't understand why. So that's the power of one single customer that is happy. A little on the second stats is a little more than half even considered switching healthcare professional to have the advantage of direct billing. So when we did the survey, we asked, right, would it take you much to change? And half of them said no. I would change in a heartbeat if I had the two options. And finally, the last stats that is really important from your customers is that 2 out of 3 Canadian would likely to continue visiting a healthcare profession, or is more likely to continue visiting a healthcare professional if they offered direct billing. So I find these statistics not surprising, yet it's always good to confirm that that's what people are expecting. I know I can tell you for Ontario in particular, physiotherapy that are registered on the eClaim platform is above 80%. So 8 out of 10 physiotherapists in Ontario is offering direct billing. Now they're offering direct billing with TELUS, right? So they're not direct billing overall. So a really important number in statistics to consider. Another thing that we can conclude from these figures is that the patient places a significant value on added services or added value beyond just rendering the healthcare service that you need to do, right? So my theory on that is that if we were taking this equally, 2 physiotherapists are equal in performance of rendering their services based that they graduated and they have their certificate. But what will differentiate one from the other? It's added value service, right? So it's availability, it's all of these things. So from a perspective of a physiotherapist, I know that you are a healthcare professional, but I'm just going to ask you to take your healthcare professional hat and put it just aside for a second and put your manager hat on and take in consideration that you are managing a clinic. All right, if we go on the next slide, so some of you might say, oh, this is great, but what is the eClaim? So eClaim, I already mentioned, is a direct billing platform, but in more detail, eClaim is a direct billing platform that is used by 90,000 healthcare providers across Canada. We are by far the leading authority in direct billing, electronic direct billing. We represent 33 insurers, and I'll be happy to present who they are in a few seconds. And all 33 insurers are exclusive on our platform and are standardized. So meaning that if you know how to work with Canada Life, when you submit a direct billing, it will work the same way for Manulife or for Desjardins or for anybody else for that matter. So we have standardized every single insurer that we have, so 33. And just to give you a figure, those 33 insurers, they represent, give or take, about 68% of the entire private insurance industry in healthcare in Canada. So basically, we are providing better health access to individual, family, community to improve their quality of life through direct billing. Because if you offer eClaim, you are putting the financial barrier aside, and all of a sudden, those clients that have financial challenges can see you as needed. I'll give you an example and then we'll move on. But a quick example. So I'm a big fan of doing downhill biking which is a very dangerous sport, and injury happens all the time. And it did happen to me a few years back. And when I went to go see my physiotherapist, he says, Michel, I need to see you twice every week for the next 3 weeks, and then we'll reevaluate. And my physiotherapist was offering direct billing, and thank God, because I don't see a lot of people who would have the financial strength to pay 2 appointments and for 3 weeks in a row, and then just wait for the insurance company to pay them back. So at that moment, I was able to focus on my health outcome instead of stressing out on my financial situation of getting the best health output that I could. All right. So I promised you I would show you the insurer. So here they are. So you have 33 insurer in there, and what I want to say is that more insurers coming. So what you're seeing here is not the end result. We keep growing. So when we started this solution back in 2008, we only had 4 insurance company on the platform, Canada Life and Desjardins, just to name the 2 biggest one at the time. But look at how this has grown. So, and we're adding more and more. And what I'm happy to mention here is that as of July 1st, in a couple of weeks, for a matter of fact, we're launching Le Régime de la Santé Publique, or PSHCP, so which is the federal government. So if you have people that working for Post Canada, good example, they are a federal agent, right? So all of a sudden now we're going to be covering all of these. You can see all the insured are right here, and we keep adding more and more. If you are from Quebec in particular, we have the biggest insurer. We have Desjardins, we have Beneva. I'll remind Beneva, it used to be La Capitale, and Beneva is the merging of La Capitale and SSQ. So SSQ will be on eClaim as of July 1st, 2024. That is coming. We have Union Vie Insurance, we have Industrial Alliance as well. So very happy about all of these insurers. And again, stand by, we keep adding more. We're adding 3 new ones this year. I already mentioned PSHEP, but there's 2 other ones that are coming on later in the year, and one of them is in Quebec as well. So very, very excited to see that insurers are knocking on our door to say, hey, we want to be part of this. We want to standardize the process. We want to make it easier for our plan members, and that goes through the healthcare providers first. All right. So this slide is very important because it's the slide which is, Michel, why would I even consider using this solution and using this solution through GOrendezvous? So the fact that you're using it through GOrendezvous means that it's seamless, right? And Philip will explain that to you. It goes really fast. Submitting the claim is extremely user-friendly. But here's 4 more advantage on that. So the first one is significant savings. So there's a credit card fees, and remember I told you to put your manager hat on. So there's reduced credit card fees, right? So if you eClaim a solution before your client pays, well, even though, and study shows everybody pays by credit card, right? Everybody does. So study shows that if they pay by credit card and you eClaim it before, you as an entrepreneur, you're only paying 2.5% of the remaining amount that is not going to be paid by the insurance company directly to you. So I'll give you an example, concrete example. In the meanwhile, I will ask my colleague, Emily, to put the link there. We have an online calculator where you can just enter numbers, and we're not asking anything else. And it gives you a good idea of how much money you're saving, right? So if you're, as an example, so rendering a service costs for like the entirety $100, and then your client pay by credit card, right? You're paying as an entrepreneur 2.5% of that, 2.5% of 100, $2.50 that you're giving to the credit card company. But if you eClaim it before, and it says your client is covered at 90%, give you an example. So out of the $100, $90 will be sent directly from the insurance company directly to you as a healthcare provider, and $10 of dollar is out of pocket, and they keep paying with their credit card. you're paying 2.5% of $10 and not 2.5% of $100. All of a sudden, that $2.50 fee goes down to a quarter. For a sole practitioner, that is still a significant amount. It's a trip in the South, right? So you can buy plane tickets. It gives you a good idea. Now, if you have more than one healthcare provider or you have more than one location, add all of this in, and you can see that credit card fees are pretty significant. I'll give you an example. More is and has nothing to do with physiotherapists, but we did launch really recently Walmart. So if you go into a Walmart and you want to buy glasses, you can go and they will use eClaim, which is the exact same solution that we're talking here, but it's for optician, right? But imagine a Walmart, the saving. So if you have like 3 location or 4 healthcare provider, that's still very big, significant. And let's be honest, credit card fees this is waste of money. So you want to save on those. The second point is why use eClaim is more follow-up appointment. And to just my example previously, when you're putting the financial barrier of certain of your customer aside and they can focus on your health, they will come and follow up, keep track of their follow-up appointment more precisely. They're not going to reschedule things. They'll say, oh, well, yeah, might as well go because, well, I have no financial impact. So it's paid for. Let me go and do it. The third point is promotion, free promotion. So we have a website where you can actually do a search, and I'll ask my colleague to put the link in the website, where people can actually just type in their zip code, and it will tell them, or their postal code, I should say, and it will tell them who are the healthcare professional that offers eClaim, notwithstanding that you're using GOrendezvous or not. So whatever direct billing professional is available there. On the insurance website, because people don't think of, I need to go see a physiotherapist, let me look on the TELUS website. They don't think that, but they'll go, let's say I'm with Canada Life, I'll go on Canada Life. The Canada Life search engine uses the TELUS engine in the back end. So you're getting a free promotion in there to just advise that you are offering direct billing. Obviously, if you do not want to be part of the search engine, so you say, I want to offer direct billing, but I don't want to be part of the search engine, yes, we can certainly make sure that you don't show up, but I wouldn't understand why you wouldn't want to show up to brag about the fact that you're doing direct billing. Why use eClaim as this last point is the client are satisfied. I mean, there are not one single person that will say, oh, I don't want direct billing. Everybody wants it. I know that it's a standard service for pharmacy, or it's a standard service when you go see the dentist, right? So if I go to the pharmacy and or the drugstore and I give my prescription to the pharmacist and he tells me, oh, I don't do direct billing, my thought process is I'll find another pharmacy. It is for sure. And this is showing up more and more in our surveys as well. People are, and I was talking about it, people would consider changing healthcare provider. 2 out of 3 would consider changing their healthcare provider to benefit direct billing, and it's coming, and you guys want to be part of that train as it's moving faster and faster. All right, if we move on to the next slide. So I'm going to take a moment just to talk of who can register on the eClaim, and then we'll pass it on to Philip to show you exactly. I know you're excited. He said, okay, show it to me already. So just taking a moment to let you know who can use the eClaim platform as of today. So on the next slide, you can see all these healthcare providers are in there. So we keep adding an average of 2 healthcare provider every year. Why are we not adding 5? Why are we not adding 10? Why maybe you're watching this and you're saying, I wish my role was in there, but it's not in there. There's a lot of reason that these are the roles that were selected. These roles were selected because the insurers are telling us that these are the healthcare provider that generates the most paper. So if you are, let's say a provider that is not showing up in there, it's probably because you're not generating enough claims to insurance versus the roles that are there. So basically, if you would be generating a lot more appointment with insurer, you would be prioritized based on insurer. So basically, all to say that these roles are not selected by TELUS, they're imposed by the insurer to say, please go and eliminate paper. Now, yeah, I saw a comment there. Yeah, osteopath. Yeah, super excited about osteopath. It's coming in 2 weeks, and psychotherapist as well coming at the same time. This psychotherapist was selected because of COVID. So all of a sudden now, psychologists, social worker are very sought of professionals. So that's why we selected them. Osteopath is not a regulated profession across Canada, so it's very important that I mention here that not every osteopath can participate in this. However, it's the big majority. On slide 10, and then I'll pass it on to Philip. That slide is very, very interesting. I know it looks like a busy slide, but it's actually a very simple slide. On the left side, you're seeing all the insurer that we support. On the right side, all the healthcare professional that we support. In the 2/3 of the table on the right side, you can see physiotherapist, technologists, and physiotherapists themselves. And you can see that all the insurers are supporting physiotherapists for direct billing. And for TFIS, the big majority is. I will remind you, for physiotherapy technologists, in 2008, it was zero insurer that recognized them. Okay, so I've done a lot of work with Denis Pelletier from the college to get these healthcare professionals recognized, and it's getting more and more attention, and I couldn't be more happier about it. I know that on the table here, it's missing osteopath and it's missing psychotherapist. Dallin, I saw your comment. I will make sure that as soon as we have the communication, I will let you know exactly who are the insurer that supports osteopath.
Thank you so much.
All right. So before I pass it on to Philip, any question? And then I'll after the presentation with Philip, get your certificate number ready, because I'll show you how to register on the eClaim platform. And just before I let you know, and Philip will take it, is that registration on eClaim, so to have a license to use direct billing, is totally free of charge. So I'm not selling you anything. We're just verifying against the college if you are in good standing. If you are, we'll give you an access. This is our guarantee that we're only working with people in good standing with their respective provincial college. All right, Philip.
So great. So I'm going to take over with like the butterfly image. It's a good fit for me. So I'll jump into GOrendezvous. So here I prepared a few appointments just to show you how it works to claim at the end of the appointment. So very simple. Let's say I have Katie Hill here that is coming in. Let's say the appointment just happened. I can click on the appointment, click on the invoice button, like we usually do when we want to take payments and everything. And now I can click on the claim button here to start a claim. And here we see we already have a few items already set up and that I pre-configured as a model. So and it's based on the service. For example, you can say like when it's a new client, I want, generally speaking, I want these 2 items. When it's a follow-up, I want a different item for the claim. So you can set it up in advance, and you can always change it as you wish. If during, for example, the assessment, there's something else that you did that you don't usually do, you can just add it. We'll keep it simple. I'll just take it as it is. I set it up with amounts and everything, and then I could have 2 choices. Either I submit the claim right away, or I request a predetermination. Let's say if the patient would like to see, like before the appointment, what is covered and everything, you can do a predetermination. But let's go at the end and just submit the claim. So this Katie is a new client, so she doesn't yet have her information. I didn't take it from her yet. So I'm just gonna take her her date of birth. So let's say she's born in 1999, March 5th. She's female. And then we'll choose her insurer. So let's say I take Canada Life. I would enter her policy number. My account is special, I have like a test account, so I can enter anything. And then I'm just going to continue. Here, we're going to answer the typical questions that are required by the insurers. And I can leave it as default, which is the most common. And you can say, like, is this injury caused by an accident? choose the accident type, etc. I think if you already use TELUS on their portal, you're used to that. Otherwise, you'll see it's very simple. I'm just going to continue. Then I have this that I have to agree to. This is the typical disclaimer from TELUS for the use of the service, the insurance terms and conditions.
Yeah, just maybe Philip, 1 second on that.
Yeah.
So basically, this accepting the term condition is basically just saying you and I know it's ridiculous. Someone say, why would you have this in there? Basically, because people abused it. You're not surcharging a specific client only because they have insurance solution, right? So you cannot surcharge a client because they have insurance, or you cannot render more services that is medically necessary for the sole pretext that they have insurance. So that's why this is in there.
Sounds good. Now that the claim is processed, you have the PDF here, which is the explanation of benefits that is created by the insurance company that you can have access to. And also, you can send that document directly to the patient by clicking send here, and they'll receive that PDF for their insurance. And now we see that we had a total of 185 was covered. It's payable to you, the healthcare provider organization, and there's a $15 payment balance to pay. So I'm going to go back to the invoice and just add a payment. I could say, okay, the person is paying the balance by credit card. And if you have Stripe enabled, you can use the Pay Now button to enter the credit card and process the payment using their credit card directly. So now that I've added that, the billing is done. I'll do the second example is a returning client. So it's a follow-up. So I can go in the invoice. I see that it's a physio follow-up. In that case, I'm going to do a claim, and I'm going to take it as it is like this. So we see that by default, it's a different setup for the claim. And also I wanted to show you here, we have like little, we have the cheat sheet. This is a link to the TELUS website to get information, a bunch of information about insurers and everything like that. So it's a shortcut here. And also, when you submit a claim, I forgot to mention in the first case, you have the consent form here that you can download, have the client fill out and add to their file. This is a document that is that you need to have the client fill out and sign to use the TELUS service. And then as you can see here, Max Fontaine is a returning client. So we already saw them. So all the insurance information is already entered. I can just continue and just go through the steps. So it's very quick, especially for returning clients, but even new clients to fill out the information and do a claim. So now I'm just, for completeness, I'm going to go back to the invoice, pay the balance by, let's say, cash, $10. Now that we have this, we can see like, how do I track all of these things? So you can go in your billing here, and you can go and see in the insurance section, for example, for today, you have claimed a total of $530. You have all the clients for whom you did a claim, which insurance company, and the amounts covered. And you can always go directly to the PDF file of the claim. So for example, if I take the Max Fontaine I just did, you can click and see the explanation of benefits, the percentages and everything. And you can also go back directly to the invoice itself. If you need to do other operations, for example, if you had done a mistake, you can nullify this one. It's important to nullify the same day as you did the claim, because most insurance companies, they pay during the night from midnight on. So you get your money very quickly. So you can nullify here the same day and make a correction. For example, if the items were, you chose a wrong item or anything, or the price, and you can just resubmit it right away. Next up, we'll show how do we configure the profile, because what you need an insurance profile in GoRendezvous to connect your account with your profile on TELUS eClaims. So for example, for this employee, Denise Gorand, original name. So we created a profile for her as a physiotherapist. So she's a provider, she's a physiotherapist. Her TELUS username, this is for the login, you type in the username and the password, and then you choose just a licensing body, the license ID, and then you have three information from TELUS that you need to get is the provider ID. You get that from your account, and we do have help docs to help you figure out which numbers from where to get them in your TELUS portal. So your profile on TELUS. So you go get your provider ID, TELUS service ID, and a clinic ID if you have one. Not everybody has a TELUS clinic ID. And then if you happen to have two professions, let's say you're a physiotherapist and you're also an osteopath, you could create a secondary profile as an osteopath when it's going to be available. So when you do when you treat someone, you're going to choose the right insurance profile. For example, if you rendered an osteopathy service, you're going to choose your osteopathy profile, and physiotherapy, you're going to choose the physiotherapy to make sure you send using the right credentials. And then if you have a receptionist doing the billing for you, you can create, in this case, you can create a data entry profile, so they can have their own username and password. You enter it as a data enterer, and then they can enter data and do the insurance claiming for you. Any questions on the GoRendezvous integration part?
I might have a question regarding the last point you mentioned. We don't have adjoint administrative, so we plan on hiring a virtual assistant, and I'm trying to figure out a way of like having her do the claims for the therapist. From a distance, virtually. So, I'm just wondering if you have any ideas of how I could do that.
Okay, maybe Michelle, can you jump in and say, what would you recommend as the credentials to use in a case like this?
Yeah, so we don't credential any assistant. So basically, Dylan, whoever you tell me that you want me to give access to you, we'll create that access. Now, every time a claim is submitted, a healthcare professional needs to be selected to be part of that. So we can do that. And as for working remotely, as long as she has an internet connection, it should work properly.
Yeah, so I just need to make sure like there's good communication between the therapist and the
of course,
the virtual assistant. Cool.
Of course.
Awesome. And now, in terms of you mentioned earlier that if you have different hats, you need different profiles, right? And I know some insurance companies do offer insurance for massage therapy, but also kinesiotherapy, right? So those are two different things. So is there that possibility in there? I didn't notice.
Yeah, so kinesiotherapist is not a role that is currently enabled on the eClaim platform, but massage therapist is.
Okay, awesome. Thank you.
Yeah, it's in the works. It's coming soon.
Thank you.
I think Teresa had a question as well.
Yeah, I have a couple questions. So this one's probably more directed at Michelle. What is the average payment delay if we do a claim and then to actually receive payment from the carrier?
It's an excellent question. 24 hours. So payments are basically done at midnight. So that's why it's, as Philip was saying, just to top up on what he was saying, is when you're submitting a claim, if you need to cancel it the day of, because at midnight the payment is done.
Okay. So I just know through like my own insurance coverage, when I submit a claim for reimbursement, sometimes it takes weeks before I
no. Well, we do have a few insured that will take longer, but like for Canada Life and Manulife, they pay within 24 hours, and that right there, that's one out of two claims will be to one of these two insured, and PSHCP, which is the government in Canada, works in conjunction with Canada Life, so the payment are done in 24 hours.
Okay. My second question is around denied claims. So let's say I have a client, we've submitted claim after claim, everything's always been approved. Now we just submit it and all of a sudden it's not approved. And I'll just say it's not because they hit their limit for whatever their allowance is for the year.
Yeah.
Is that something that in GOrendezvous we would just go through a nullify process and maybe change the code because maybe something on the back end, or do we just nullify it and say, okay, you work with your insurer? Because I don't want to be on the phone with insurance companies either, having to like
No, I'm not. I don't want you to. Okay, so if a claim has been nullified, if a claim has been rejected because there is no more amount in the plan coverage, you don't need to nullify it because there was not going to be a payout out of it, right? So you don't need to call the insurance company.
Okay, that makes sense. It's like other reasons that.
Okay, so if ever that happened, it gets rejected for whatever reason. So I'll give you an example. The first question I always ask is, what time of the year is it? Is it end of December? Possible that it might not go through. If it's like middle of April, why is it rejected? And it's always been approved before. What you do at that moment is you tell your client, pay me the entirety of it. Here's an insurance receipt. Call your insurance company directly and verify what's going on. Okay. Here's the thing, Teresa, even though you call the insurance company, because beyond the fact that you're going to wait on the phone and they're not going to give you any information, they will reject your any inquiry that we'll have, because their mentality is that the plan is confidential between them and your client. Right. So they're not going to help you. So don't call them ever. Okay, so it will be just for your client. So you would say to your client, please pay me now, call your insurance company and verify. And it could be a bunch of reasons, right? It could be that they changed your insurance company and the client didn't read their email, or it could be as far as, you know, they're gonna be let go, but they're not aware yet, but they already cut the insurance on the other side. So it could be a million reasons, but don't be caught in the middle of that. Just pass it on to your client and they'll be managing. Because in the perfect world, and I know it's not the case, but in a perfect world, people should know their insurance coverage. They should know how much his money is left. But the matter of the fact is, most people don't know. They will rely on you. But at the end of the day, you are not the custodian of the plan insurance. You're just helping the client submitting the claim so he doesn't have to do it at home. And that's it.
Okay. My third question for you, Michelle, is around, so I see that you cover naturopaths. Are under the umbrella of naturopaths, I know there's also another category of a naturotherapist. Are the naturotherapists under that naturopath umbrella, or are you looking at as a
currently they are not. Okay. It's something that we are considering for 2026. I'll from a insurer perspective, like 2024 is next, it's like tomorrow, right? So it's something that we are considering, but there's also, based on that, there's also like we are working with speech therapists, but we're not doing audiologists. We're working with dietitian, but we're not doing nutritionists. So these are all the 2026, we call it the leap year, which is the year that we're going to be catching everybody that we've put on the side that is somehow recognized, but will be coming part of that, because we're for 2024 and 2025, we already have selected the roles that will be coming on the eClaims platform. So and I can give you a heads up for 2024. 2024 will be clinical counselors, and registered clinical counselor, and nurses. So all these nurses that are working in private healthcare industry, like mainly blood sampling clinics and so forth, so will be recognized on the platform. Okay.
So no other questions, so we'll go back to the presentation, and I'll give it back to Michelle.
All right, thank you, Philip. I will steal away your presentation, and I will share mine on my side. So two things I wanted to just share with you right now. So right now you should be seeing the saving calculator online. So Teresa, just to go back to what you were saying. So I know there's cost to use GoRendezvous, but just wanted to show you that using eClaim can not only offset that cost, but can give you saving. And I'll be very minimal on this. So let's say that number of eClaim you do in a week is 10 in a week. That's 2 a week, considering you're not working on weekends. And let's say you're working 48 weeks a year. You're taking 4 weeks off somewhere. And what's the average cost of what you would charge normally? Like, give me ballpark figure, 60, 70?
100.
Okay, so we'll keep it at 100. And your credit card fee is 2.5, which is, by the way, 98% of all entrepreneurs. So
That's
this
0.65.
Yeah. So the saving per year is $1,000 of credit card, and we're being very conservative on this. Okay, so this is the amount of credit card savings that you would be doing right now just by using eClaim. So I'm sure this 1,000 can offset GoRendezvous cost. Like, it's not entirely. I don't know the amounts, but it's still $1,000 that you're throwing down the window for credit card fees. That's what I'm trying to say. So that's where it becomes very interesting. All right, let me close that. All right, so I put in the chat there where to register. So registration is right here, very simple. So you would just put your name information. You would select your practice as independent. You're an organization if you're named Walmart. Okay, if you're not Walmart, you don't need to, you select independent. And then you would select your province, and then what type of healthcare professional you are. So physio technologist, I'll select as an example. Then I would put my name and everything in here, and then I would just click and make sure that I click on all these 3. One of them is really important, which is to accept the term and condition, which is basically making sure that you're not using the TELUS Health solution for the wrong intensive purposes. Teresa, yes, your hand is up.
Sorry. So you had said only select organization if you're like the Walmarts of the world.
Yeah.
So even though like my company is made up of multiple practitioners, I still would do independent organization.
How many addresses do you have? Okay,
sorry.
so yeah, independent organization.
Okay, perfect.
Yeah, it's not independent providers. It's you're an independent organization. You're not a banner organization, basically. That's what we're trying to say. Okay, so perfect. I would click on continue. Yeah, sorry, I'm gonna take this off. This is a fictional email address. There we go. Will bring me to the second step here. So it will ask me for my phone number. So I'm just gonna put a fictional phone number in here. City, I could put the address here, and it's by Canada Post, so I would select the right address. I selected Quebec, so I'll just choose a Quebec address there. And then if this location is part of a commercial banner, please specify. It's optional, so I would put Walmart, but it's not. What clinic management software are you using? So if I am using a solution, you would find it in here. So I'll say GoRendezvous. I'm using GoRendezvous. And then I will click on this little box there that says, I authorize TELUS to communicate with GoRendezvous. And we'll give GoRendezvous your ID and everything so that GoRendezvous can set up your profile. So very simple. And then I will.
Michelle, I'm sorry. Dalen's asking if we can have the list of the accepted osteopath associations in Quebec. Are we able to send it to them at the end, maybe?
Yeah, absolutely, Dalen. I'll send it to you, not a problem. Yep. So I'll put my company name here, so Michelle Inc., and then go to the administrator profile. And that's where I would put an assistant, right? So if we want to have in there, or we could add another healthcare provider. So I could say this is me, but I could add another one in there. I could select the reason why I'm signing up to eClaims. So I could say, better serve my client. College of Physiotherapy of Quebec is selected by default because I took TEFIS, and TEFIS is part of the college. License number. So it's basically your license number you would put here. and then the date of when you got that license. I'll just put any date in here. All right, company information, they're all optional, so we'll just skip it because they're optional. Why not? Why even bother to enter information unless you really want to? Then I will review and submit this. I am authorized to submit these this application. Submit, and it's going to give me, and this is where it's really important, a confirmation number. Key that confirmation number really close by, because if there is an issue and you need to call us, like I said, we have 90,000 people on the platform. So finding you by name is going to be extremely painful. So ideally, you have that tracking number that we can just find right away. And from that moment, we'll verify with the college if you are in good standing, and if you are, you will be able to actually start using eClaim. It typically takes about 2 weeks. It's not long on our side. It's just colleges are not super responsive. But we're really just verifying, are you in good standing? If the answer is yes, there you go. If ever there is no college, a role is not regulated. Osteopath is a good example of that. We are working with the association, and these associations are acting as college for their own member only. And that's why, Dallin, we're working with some specific association and not all of those associations. So, and we would verify with that specific association, and same thing, if they are in good standing with the association, they would get access to this. All right. So I stopped the sharing on this. We're at the part of the question Q&A there, but I think we already did a lot of those, but maybe Philip, did you want to add any concluding argument, and then we can go and see if there's more questions?
Sure. Like one thing I forgot to mention earlier, we also have the GOrendezvous search page that is getting more and more popular. Like we actually realized recently, not so long ago, that we were helping clinics get an average of 1 new patient every month from our search page. So it's getting more and more popular. And also, if you have eClaims enabled, it's going to show up on your profile on the GOrendezvous search page that you offer direct billing. So that can also help acquiring new clients. So yeah. I'll let but was there any other questions about the whole presentation or anything that popped up?
Well, there's a question from Teresa here. So can the list of Quebec Association for Massage Therapy and Naturopath also be provided? Yeah, I just put you the link in there, Teresa. If you click on it, and you go to the bottom of the page, the just before the continue icon, the second line there is a, am I eligible? Click on eligible, and then you can select Quebec, and then massage therapists, and they're all there. So everything there. If you want naturopath, just select Naturopath Quebec. They're very simply available there. The only one that's not there, and I owe that to Dallin, is osteopath, because, well, we didn't launch osteopath. That's why it's not showing up yet. But it will as of July 1st.
Perfect.
So I hope, yeah, and you can check this with all roles across all provinces. If ever a role is not recognized in a specific province, let's say physiotherapist, technologist in Ontario, which most of them are in Quebec, and you select it, it's gonna say here it's not available in Ontario quite yet, but let us know your email and we'll advise you as soon as it's coming live. Awesome. Let me echo Philip's last comment there. Any further question or comments?
Hi guys, sorry, my camera's not working. My name is Marcella. I'm a dental hygienist.
Hi, Marcella.
Hi, I just had a quick question. In Quebec, dental hygienists became independent since 2020, and I think there's a few of us that are using GOrendezvous. Are you aware of like any dental hygienists off the top of your head, or dental hygiene? Like we have our own order, so it would be a good platform for us to use, I guess, because we will be claiming through TELUS Health as well. So if we have like specific questions, I guess I can contact you guys for
yes.
Maybe.
Michelle, for the dental hygiene, are they available on the in the interview?
Yeah, the answer is yes. I love Marcel. I love that question. But the answer is yes. It is available. However, it's not the eClaim solution. So basically, we have 3 direct billing solutions. So we have one for a drugstore for a pharmacist. Then we have a second one for dentists, and then we have one for everybody else, which is what we're presented today. So for the dentist one, it's not integrated. And Philip, correct me if I'm wrong. I don't think it's integrated with the GOrendezvous, but it will be for the GOrendezvous to maybe consider that opportunity, but that would be a different integration specifically, and not the eClaim ones.
Okay. All right. Thank you.
Any other questions?
Great stuff, guys. Thank you.
And thank you so much for everybody for your time and for being here. We really appreciate it. And we're going to wish you a great week.
Take care. Bye-bye.
Okay.
Thank you, everybody.
Thank you.
Bye-bye.
Bye.
Bye-bye.
Bye.